afternoon. Thank you, everybody, for being here. Appreciate y'all's attention to this evolving and worsening coronavirus pandemic, especially in Mississippi. Today, obviously, we reported an astoundingly high number of cases, over 1,000. I would say that this is a surprise, but it's not even remotely a surprise. It's something that we've been seeing progressively increasing. We've had numerous warnings, admonitions, and we want to be able to go over this a little bit with you guys and answer any questions. And at this time, I'll turn it over to Dr. Byers.
Thanks, Dr. Dobbs. Good afternoon, everybody. Yeah, we're reporting 1,092 new reports of cases today, 5 new deaths. Over the past couple of days, we have had some increases in the number of cases. Really, since this pandemic began in Mississippi, we've seen gradual increases in cases from day to day. With the recent numbers that we're seeing, it has not been completely unexpected. We are seeing community transmission. We are starting to see cases among young folks. We're seeing a good number of our cases now are in those age groups between 18 and 29. I think it's important to understand that we've seen some increases in some counties, but the reality is that this 1,000 cases are not tied to any one particular event. They're not tied to any one particular county. We are seeing community transmission throughout Mississippi. And really, honestly, one of the big reasons we're seeing community transmission is because people are still not social distancing. They're still not wearing masks. They're still coming together in very large groups, parties, barbecues, social events, and these aren't even really associated with necessarily businesses. These are transmission that's occurring out in the community. Guys, this is something that we can really have an impact on if we all buy in to doing those things that really are necessary to prevent transmission. We've learned a lot about this virus, and we know how it's transmitted, and it's transmitted through that very close contact with somebody within 6 feet for 15 minutes or longer. And, there have been lots of parties where 300 plus people are getting together, and they're close, and they're drinking after each other. Look, guys, this is not we can't act surprised that we're seeing these types of increases in cases when we're not wearing masks, when we're still gathering socially, when we're not thinking about whether or not we need to go out and do something. Because let me tell you about the 18 to 29-year-old age group. The vast majority of those folks are going to recover without any long-term problems. But the thing about it is that they can spread that to the vulnerable population, those people in the older age groups. And now we're learning that really the risk increases as you get older of having more significant outcomes. But they can spread it to those people who are in the most vulnerable population. I think one of the things that we've seen and one of the things that we have worked very hard to do over the last several weeks is have an impact on cases in our long-term care settings and an impact in the deaths that occur among long-term care residents. If you look at our data, you see that our deaths are going down. You can also see that we're having a decreasing number of long-term care outbreaks. We're also seeing a decreased number of cases among long-term care residents. But it will not be surprising if we start to see increases in deaths again and impacts on long-term care settings. So the things that we need to do are we need to continue those things that we've said we need to do from the very beginning. We need to wear masks. We need to social distance. We need to avoid large gatherings. We need to think about those gatherings that we're going to. Something as simple as a party can result in transmission to hundreds of folks that can have ripple effects down the line. I think that's everything.
Thomas, would you talk a little bit about the problem that we're going to have if this continues?
Yeah, and one of the things that we have to make sure we really are thinking about is our objective of making sure we have adequate healthcare resources for people in need. We have seen significant stress on the health system And then over the past couple of days, we've seen the highest number of hospitalized patients as well. Not so much ICU utilization, but there's a sequence from hospitalization then to ICU. And I'm absolutely terrified that we're going to overwhelm the health care system, the hospitals and ICU, not in the fall, which is something that had worried me previously, but I'm worried about next week or 2 weeks from now. We're already tight. We have a massively growing population of infected people that are going to transmit it more and more to older folks and people who are going to have severe adverse outcomes. This reckless social behavior is going to harm the whole state. It's going to harm the businesses in the state. It's going to harm our economy, and it's going to cause unnecessary deaths. And we just got to do those simple things, or we're going to pay the price.
Okay, thank you. We'll take questions at this time, and we're also streaming this live, so we're going to take questions from other reporters as well. Yes.
Dr. Dodd, you had just mentioned the ICU situation. Do you have any numbers with how many ICU space room we may have that's available and how many people are currently on ICU, whether it's UMMC or other health systems, to give us a sense of what the leeway is right now?
Yeah, Dr. Byers has those numbers in front of him.
And what I can tell you is if you look at our data, and we have this on our website, for the number of patients who are COVID positive currently in the ICU and currently on the ventilator, we haven't seen those big increases yet that we've seen associated with the hospitalizations. But that doesn't mean it's not gonna happen. We do have ICU beds available in Mississippi, but that's not universal across the state. You know, anecdotally, we hear from many hospitals that their ICUs are filling up. And, you know, as we think about going forward into the fall, and we've predicted that, you know, the fall could be potentially significantly worse than we're seeing right now. If y'all remember flu seasons we've had in the past, flu seasons can absolutely completely fill up your ICU. And you throw COVID on top of that, and then you throw the individuals who are going to need the ICU and that direct care for other medical problems. You know, it's a risk. It is.
So right now, indoor gatherings of up to 20 people and outdoor gatherings of up to 50 people without social distancing are allowed under the current executive orders. Are you confident that the spread is coming from gatherings that exceed those limitations?
A large part of it certainly is. Certainly, with the outbreaks that we've looked at, they've been people gathering in mass. But it's not just those events. I mean, sometimes if you go to certain restaurants and stuff, we see that people aren't complying. Bars and things like that. It's just, and it may well be that we can't leave it at 20. You know, as this goes on, something's got to change, right? I don't know what we're going to do to make sure that it's enforced, and we'll have to figure out what that is. But people are getting together in reckless manners, and it's also a frequency thing too. This is not we can't be normal if we don't expect to just run this pandemic through the roof, and that's what we're doing.
We talked yesterday about the whole facial mask and whether or not there maybe should be a statewide mandate for that, if nothing else, just to kind of remind people of its importance. Is that something you think you might consider broaching with the governor after today?
You know, we've spoken a lot, and obviously the governor is keenly interested in helping to get better control over this thing. Everybody wearing masks statewide is absolutely desirable. How do you get to that is a real question. Until leaders across the state, at the state level, at the local level, law enforcement, the people who we depend on to be our examples, embrace it and understand, it's going to be really an untenable ban. I mean, an untenable mandate. So I'm hoping that people will engage in this, and I would look forward to a day when we could have universal acceptance of masking in public.
Well, why not start at the top? Why not issue the mandate and then work on applying it statewide?
And certainly that's a healthy discussion. But you're out there. You see what people are doing. You see these events where leaders are not wearing masks. And so until the leadership adopts it and buys in at all levels, businesses too. I think our business leaders, by and large, have been really proactive, making sure that they can be aggressive leaders. But I would encourage our business leaders to really push for this because it's going to keep them open.
Hold on a second, Nick. Let me take some questions from folks out there. Anita Lee with the Sun Herald. She said, to what do we attribute the new cases and where's the spread the highest? I think we talked about the new cases. Anything about where the spread is the highest?
Well, certainly we're seeing, increased numbers of cases in those areas where we see higher populations, But I think it's evident that what we're seeing is community transmission. When you drill down to a county, what we're not seeing is that it's necessarily associated with a large definable outbreak at a facility as much as it is broad community transmission.
And she also wants to know what action is MSDH recommending Governor Reeves or state government take to slow the spread?
First and foremost, follow the current rules, for crying out loud. I mean, if enforce what the rules are. At the Department of Health, we're going by restaurants and we're going to make sure that they're following the rules, that the employees are wearing masks, that they have the tables separated properly. And then in the local communities, we have to enforce the rules that are there. That's the first thing. And then looking at other measures that we may have to do. There's been this mad rush to get back to normal. People are fixated on things that are not essential for life. They're fun, and I understand it. But we'll look at doing more aggressive stuff. We're going to have to because this is just going to continue to get worse. And we'll continue to work closely with the governor's office. We spent a lot of time today talking about it, thinking about what our next steps are going to be. So I expect you'll see some stuff in the near future, but I don't want to commit to anything until we come to some sort of final conclusions.
You have said that you're worried about the hospitals being overwhelmed in a matter of weeks. Have you been in contact with MEMA to set up some of the breakout hospital?
Yeah, I'm going to tell you, the breakout hospital is a fallacy in reasoning because there's no staff. There's no staff to do it. Now, if it got so bad we had to pull in federal resources, we would. But the things that we would do are the things we know are going to work. It's going to be canceling elective procedures. It's going to be doing that stuff that was very harmful to the healthcare system or in the health economy before. And we may have to go that direction. We're working aggressively with our healthcare partners to make sure they have expandable capacity. There's some variability from location to location whether or not they can do it. And this is something that we've talked about. And if hospitals are unable to meet the internal needs of their community with ICU resources and staffing, then there's two choices. They can expand and open up additional units because there is excess capacity within hospitals. It's not a location issue. It's a staffing issue. And so that's something that has to be addressed. But there's two parts of the equation. There's supply and demand. And we may have to look at selectively even more so about looking at elective procedures because time and time again we know that if those are not allowed, it will open up space within the healthcare system.
And is that in the works? Are we planning on winding those down statewide?
We're talking about all options. I don't want to commit to anything. No.
With elective procedures, a hospital beds are already kind of limited with there, and then with COVID patients, they have to be isolated. Where are those two going to meet? Where you need more hospital beds to accommodate COVID patients versus running the elective surgery beds.
For a lot of the patients, it's ideal to have them in negative pressure isolation, and so there is limitation in that, but a lot of it is can be done in normal rooms if we have to, and that's okay. And certainly we've seen the hospitals take some innovation as converting areas to negative pressure so that the air is externalized. But if we do make sure that we have adequate capacity, then there'll be adequate resources as far as like staffing and PPE supplies locally and all that to take care of the people who need to be taken care of. But it would be manageable even in that balance.
Okay, let's take a few questions here. Erica Hensley with Mississippi Today wants to know, is there a particular cluster associated with today's 1,000, and are there particular community outbreaks of concern?
Paul, you want to answer that?
Yeah, our investigation into certainly to the new cases is still ongoing. We just got those cases yesterday. We're starting our investigations now. So, we can't say exactly what all the new cases are primarily due to and what they're associated with. But in general, these past few days with these increases that we've seen, it hasn't been, one particular cluster or one particular community.
This question, I guess, could be for either of you. I've been speaking to some medical coders in the field, and what they're telling me is, instead of seeing totals per day throughout the state, it would be better to contact trace if we did measurements per county on it and gone by day. Can you tell me first off, how are we doing the measurements again with how many cases, and do you think you could do better contact tracing if we broke it down by county per day instead of just doing totals, weekly or whatever?
So our contact tracing is based on an individual case investigation. So we investigate every case that's reported to the Department of Health and identify contacts and make sure that folks are quarantined and make sure that the cases are isolated. That's done on an individual case basis as that case is reported to us. And so, we don't do that based on looking at a county, or we don't do that statewide. That's on a one person. If you look at our data that's on our website, we present those cases on what's called an epicurve, and we have that demonstrated on the data that we have on our website that occur by day. And so when a case is reported to us, that doesn't necessarily mean it occurred that day. There's often can be a delay of when that person really became sick and was reported to us. So I encourage you to look at that per day. Now, we are going to have some county snapshots that'll be available soon, and that'll provide some additional granularity for folks to be able to see how those case counts are unfolding within their counties.
Okay, I've got Aaron Kelly from the Meridian Star. How has the state been helping with the Mississippi Band of Choctaw Indians, which continues to see steady increases, especially in the Pearl River community?
Yes, certainly we acknowledge what a big challenge that is with the Choctaw tribe. We have had testing locations and work closely with their health center and also with their leadership and Chief Ben have been very committed. They have some of the same challenges everybody else does, and we're trying to work with them. And I know we're doing some epi cooperation with those guys too. But we're committed to continue that partnership. Whatever support that they need, we'll want to do that. And Paul, I don't know if you want to say anything more.
No, and we work with them closely, and working with the Mississippi Band of Choctaws is not a new phenomenon. We worked with them over the years on whenever there are communicable diseases or outbreaks. So we have established relationships with them, and certainly we're willing to partner and assist in any way that we can. And they have their own public health and their own contact tracers and stuff, and we work with them, and we have a good relationship.
No, go ahead.
What do you say to the people that are arguing one way or the other that maybe there's more testing going on? Is there more testing? Does that even matter? Could you speak to those people?
Our testing rates are relatively stable now compared to a month ago. I mean, if you look at the number of tests we've done, we're not doing any more tests than we did a month ago, at least not significantly. We did a lot more tests when we had the nursing home push, but the percentage positive, that was very low. We're seeing a ton more cases. Our percent positive is higher. We're seeing significant hospital utilization and increased cases. On our COVID-like illness on our surveillance system, we're seeing increases. I mean, every indicator's up, right? I mean, we can stick our head in the sand and try to find excuses so that we don't have to modify our behaviors, but it doesn't change the truth. The truth is there's a lot of COVID out there. It's killing people. It's going to kill a lot of people, and it's going to stress out our healthcare system. That is just reality. And if people don't want to acknowledge it, then, I hope that when they go to the ICU and want care, that there's care available for them.
The Trump administration is ending federal support for many testing sites across the nation. Does that endanger our testing regime at all?
They've never helped us with that. But they've given us supplies and stuff, but we've done all of our own testing support here.
Are we planning on ramping testing up now that we're seeing more cases?
Yeah, well, we're going to do testing where we have to do it. Certainly we're going to target it. A lot of here's the other thing about the testing. I want everybody to know. Most testing is in doctor's office because people are coming in sick. We're not out there drumming up a lot of people who aren't symptomatic. We do, like we call it a good bit, from the nursing home and stuff, and we do check some asymptomatic people through the drive-thrus, but it's people who are sick. That's what's triggering the test, and that's why we're finding them in these clinics. Our docs and nurse practitioners in clinics have done a fantastic job providing the service.
And there's broader availability to testing now, as well, compared to where we were just a month ago.
And that's the best place for it to be, because then you have testing in every location with a lot faster turnaround. And so I'd just like to commend our health system and our frontline physicians and nurse practices and clinics for doing the great job they're doing.
Look, if you're trying to get buy-in from some of the state and local officials to take this more seriously, can you say what type of real cases will occur if this continues on its current course, as far as hospitals, as far as people getting treatment? What would you say to them?
We're just seeing the same thing we saw before. Our memory shouldn't be so short. There's cases, there's a lag, there's hospitalizations, there's ICU use, and there's death. And then there's infiltration in the nursing homes. It's the same sort of sequence. And we have aggressive efforts to protect our nursing homes, but they're not impervious. People work in the nursing homes. We were hoping to open up for visitation, and this is screwing it up. It is so selfish for people to be out doing stuff, perpetuating this pandemic for nothing more than the crawfish boil.
I guess what I was trying to get at is, if the hospital rates continue to climb, what's going to happen to not only people who have coronavirus, but car crash victims, people with heart attacks?
Yeah, so I hear stories all the time. People go to the ER with a fracture or something. I had this weekend. Someone had a broken leg and they couldn't get a hospital to take them anywhere because there were no beds in the hospital. That worries me to death. It doesn't matter what your problem is. When the hospital's full, the hospital's full. If you have a heart attack and you need a ventilator for 2 days and you're going to be normal, well, if there's no critical care team there to take care of you and there's no ICU beds, they're going to try to shuffle you around. We've had people spending overnight and days in the ER like it's an ICU because you can't get them anywhere. And this is just going to get worse. And this is one of the things, the very important thing about our healthcare system is people do well when they can follow the standard of care. When they have the proper people with the proper equipment doing the proper work for you within the proper time frame. And if we stress it out and people are running around crazy like we had in New York City, if we're not careful, Mississippi is going to look like New York at the height of the pandemic. And it's in our hands. We have the choice. And it just baffles me.
State health officers talking now about the spike in coronavirus cases in Mississippi today. More than 1,000 cases just today. You can continue.